So let's look at this lumbar series on this patient. The first thing is that the lumbar spine has a little bit of a curvature going. The other thing is you can see a lot of almost like bridging. The bone has osteophyte formation, the spaces are very narrowed, and these are basically bone spurs kind of calcifying and attaching to each other. So eventually it's like the whole spine is getting calcified. So this patient most likely has chronic back pain, decreased mobility, maybe even something called ankylosing spondylitis, which basically the spine becomes like a bamboo spine. They become all ossified and the patient has very decreased range of motion. The other finding here is obviously a lot of stool in this part here, so maybe some constipation. But then this part, not any stool at all. This is all airfield and measuring very, very big, 120, I guess 12 centimeters in size, right? So that's a dilated gas-filled loop. So you wonder if this is full, this is empty, could there be a bowel obstruction or something like that in there? So at the time of this interpretation, we don't know if that was the case or not. The patient was discharged, so we're gonna be following up with him later on. But the other thing, look at this, so the spine going down, a lot of osteophytes, almost calcified throughout here. And look at this, this is an abdominal aneurysm that's been repaired. So they put this little mesh and stents to kind of stabilize the aorta as it comes down, probably into, yep, you can see it here, and coming down into the right iliac, left iliac. So definitely some diffuse peripheral vascular disease, probably had aortic stenosis, it was or maybe an aneurysm that dissected and needed that kind of procedure. And that's just another view of the lower lumbar, sacrum, coccyx and whatnot. And I thought that this was a very impressive x-ray, a lot of cool findings on it, and I wanted to share it with you all.